Welcome to your first lecture on evidence-based practice. The objectives for this lecture are to define the concept of evidence-based practice, given a study, classify the level of evidence, to describe the types of research used in physical therapy research, and to understand how to search the databases and form a literature search. First of all, let's consider the question of what is evidence-based practice. Evidence-based practice is a method of clinical decision-making and practice that integrates the best available scientific research evidence with clinical expertise and a patient's unique values and circumstances. This means that you cannot have evidence-based practice without integrating the patient's viewpoints or the clinical practice expertise of the practitioner. The reason why we use evidence-based practice is to provide the best care for a patient by utilizing the best available evidence to optimize patient outcomes and to ensure true informed consent, because we can truly educate the patient regarding the chances that the treatment will work versus if the treatment will not work. Evidence-based practice is a three-legged stool. For the evidence-based therapist, these three sources of evidence, clinical expertise, scientific research, and patient values and circumstances form a foundation from which you and your patients work together to determine the best course of physical therapy care in any given circumstance. This is influenced by context, the environment in which the patient needs to operate, and the organizational context, factors that influence care from a systems approach, such as patient compliance, documentation, patient and therapist values, patient expectations, and patient circumstances. For example, is the patient insured? Are they uninsured? Do they have access to care? Can they accommodate the schedule provided by the clinic? Do they have a certain disease state? Or do they have certain cultural norms that might influence the course of their treatment? What you should hear then is evidence is negotiated. Evidence is negotiated between the therapist and the patient, and you have to balance what your desired treatment is with the patient values, expectations, circumstances, your skills, your experiences with patients, and your expertise with the scientific researches in order to make an informed decision. There are certain steps taken as we explore evidence-based practice. We're going to be covering these in more depth through the course, but let's identify them now. The first is we identify the need for information and develop a focused and searchable clinical or research question. This means we need to have a question that is answerable in the context of the available evidence. We second conduct a search to find the best available or possible research evidence to answer the question that has been posed. We critically appraise the research evidence for applicability to the patient or research question and the quality of that evidence. We integrate the appraised research evidence with our expertise and the patient's values, preferences, and circumstances, and then we reassess the effectiveness of our research and its application to the particular clinical or research context. There are certain research types seen within physical therapist practice. These include clinical and non-clinical research and under the scientific umbrella. Scientific research evidence is empirical evidence acquired through systematic testing of a hypothesis. Therapists access two general types of scientific research, clinical research and non-clinical research. Clinical research involves human subjects and answers questions about diagnosis, intervention, prevention, and prognosis in related to disease or injury. Clinical research helps us to understand scientific research applied to the clinical environment. Sometimes this is termed translational science. Non-clinical research can include studies on healthy humans, animals, cadaver specimens, and cell specimens. From these studies, people can extrapolate with cautions how patients will respond in a clinical situation. For example, studies of healthy individuals can help therapists understand what is typical and can lead to hypotheses about how best to care for patients with an injury or disease condition. Additionally, studies using cadaver specimens can help therapists understand how body tissues might react to specific forces in ways that would not be feasible in living persons. There are certain types of research that we will commonly see in the physical therapist literature. One of these is a meta-analysis. A meta-analysis combines data from several studies to answer a question of interest. The methods used in a meta-analysis from individual studies that are combined must be similar in terms of population, intervention, and outcome measures in order to do statistical analysis. Data are synthesized to normalize results across all studies, and this can be used to produce practice recommendations. This can be part of a systematic review. We also have clinical practice guidelines. Clinical practice guidelines help to develop best practices for a profession. They summarize a large body of evidence, and they make general recommendations for most patients who are classified, who meet the inclusion and exclusion criteria for the clinical practice guideline. They may help us identify research articles to help inform practice. These are considered secondary research studies because they're studies of research studies and are authored by experts in the field. These include direct recommendations for practice that combine the best available clinical research, clinical expertise, and ideally patient perspectives. We also have systematic reviews. Systematic reviews involve a comprehensive lit search of all studies related to the question. This does not necessarily include the data included in those studies. These have specific inclusion criteria and reproducible methods, and they have a standardized analysis. These produce recommendations for practice by synthesizing and summarizing the results of high-quality studies. These can appraise diagnostic tests, treatments, outcome measures, and prognostic factors. Next, we have randomized controlled trials. These include a sample of interest, and they include appropriate power to determine an adequate sampling of the population of interest, meaning we have to have an adequate number of subjects included in the sample to make sure that we are ruling in or ruling out the hypotheses that we establish initially correctly. Participants are randomized to 2 or 3 or 4 groups in an intervention versus a control, and participants can also serve as their own controls. From an outcome standpoint, they might compare interventions groups to determine if there is an actual effect. Cohort studies are another study that we see in physical therapist research. The definition of a cohort study is groups with common characteristics are followed in a prospective manner looking for an outcome of interest. For an example, people with risk factors for heart disease. These look at prognostic factors to determine if there are certain factors that may predict a certain condition for developing. Who will develop heart disease, for example? The sample is defined and representative of the population, and there are specific points at which the population is measured. These measures are relevant factors. People are masked to what these factors are, and there's a time frame under which people are masked and over a period of years in which people are measured. And it looks at what happened to these people over time. Did they develop the condition of interest or not? We also have diagnostic studies. Diagnostic studies are a type of cohort study. These look at the use of a clinical test to diagnose a specific condition compared to a gold standard. For example, we might look at a Lachman test, which is a test for ACL tear, in comparison to an MRI, which is the gold standard. We have a defined sample, which means all the people have a common presentation or cluster of symptoms, meaning everybody in the study would have an ACL tear. And we would do a blind comparison of the new versus old tests, and all subjects will have both tests. And the outcome is determining whether the clinical test used determines what it's supposed to determine. We also have case control studies. These are conducted after an outcome of interest has occurred, and they try to establish factors that differentiate between two groups of people. These are prognostic. They, however, are done after a condition of interest develops. These are ranked lower due to lack of control and monitoring. However, they look at factors that contributed to the outcome in a group that has the outcome as compared to a group that does not have the outcome of interest but is similar to the case group. For example, a group of athletes with repeated ACL tears may be studied in comparison with a group of athletes without ACL tears. The outcome of interest, repeated ACL tears, has already occurred, and the researchers are trying to identify the factors that contributed to these repeated injuries. In a case control study, a group without the tears but comprising those who play the same sport and who are of the same gender of age range would be compared on all factors thought to contribute to the risk of tears. Note that this is the same problem as given in the example for a cohort design, what factors contribute to ACL tears. The difference is that in a cohort study, the event has not yet occurred, whereas in a case-controlled design, the event has occurred, and the group with the event is compared to the group who has not experienced the event, but is similar to the case group. We also have case series and case reports. The sample when a case series and a case report has inclusion and exclusion criteria that are specific to that case. The methods are standardized with a repeated baseline, and this looks at a case or series of cases to monitor treatment outcomes and equivalency over time. An area of developing research in physical therapy is qualitative. Qualitative research is interested in understanding how people interpret experiences, how they construct their worlds, and what meanings they attribute to their experiences. There is basic and applied research. Basic is motivated by intellectual interests and the goal is extension of knowledge, and applied is used to improve the quality of practice of discipline. There are various methods of data analysis using a detailed approach to make meaning. The methods used could include a case series, case study, randomized controlled trials, or cohort studies. We'll talk a little bit more about qualitative research in upcoming lectures. We also have narrative review and expert opinion. This is simply a review of the literature without standardized methods conducted by an expert. The expert selects material to include, and it's descriptive in nature. When we think about all these different types of studies, they have different strengths of evidence. We classify these strengths of evidence by the level of strength of their evidence. So these are the types of levels of evidence that we have for therapeutic studies. 1A is a systematic review with homogeneity of randomized controlled trials, meaning that the randomized controlled trials are similar enough to do meta-analysis. 1B is an individual randomized controlled trial with narrow confidence intervals. 1C is an all or none study, which means that everybody had the outcome of interest and it did not make sense to randomize them into a randomized controlled trial because the not providing the intervention would have caused fatality. 2A is a systematic review with homogeneity of cohort studies. 2B is an individual cohort study. 2C is outcomes research. 3A is a systematic review of case control studies. 3B is an individual case control study. 4 is a case series, and 5 is an expert opinion. When we talk about evaluating evidence, we're going to think about evaluating based upon the type of evidence and the applicability to the research question. When we perform basic research evaluation, we're going to be looking at 4 things. The research design, meaning what type of design was used in the study and how does that contribute to the reliability of the evidence. The analysis done in the study, whether it was reliable and valid, whether the results were interpreted correctly based upon the analysis of the findings, and how can the findings be applied to the particular patient. We'll discuss this in a little bit more depth as we go through this course. But first, let's talk a little bit more about how do we locate evidence in physical therapy. When we talk about library resources, there are certain databases that we can find through O'Kelly Library. If we look through the databases in O'Carroll Library, we can go here and we can search for databases by subject. If we go to physical therapy, we submit our subject search, and this will give us all of the things that are available to us to search for physical therapy. We also have a physical therapy LibGuide available through the library, which gives you another link to the resources that we have here, and also gives you some database tutorials of how to use the different databases that are contained in the library. You can also click on libanswers.com, and this will give you some questions about the library. And then you can also chat with a librarian if the library chat is available. You can also call 750-2454 to speak with a reference or research librarian to help you with some of your literature searching. Let's talk about developing search terms. I'm going to play this video to help you with some of that.
You have an essay due date coming up. You've already chosen a research topic, but how do you move forward? Start with a search strategy. A search strategy is the process by which a research question or topic is divided into keywords with synonyms, words that mean exactly or nearly the same thing, to be entered into a library catalog, database, or other internet search engine. All you need to know are the basics to get started. The keywords you choose to search with will directly affect your search results. Therefore, the best possible keywords equal the best possible results. The best possible keywords are the words that are the most relevant to your topic. This means that the words you choose should directly relate to the topic that you're researching. Before you begin a keyword search, think about your topic. Decide on some words that express the most important concepts of the research question. Do this activity before you sit down at the computer to search, so that you aren't tempted to search with the first words that come to mind. Grab a pen and paper and let your imagination flow freely without distraction. Think, what should the articles and/or books be about? If your question is, does driving a vehicle impact the environment? You could use vehicle and environment, not words like effect, impact, or reaction, which are comparative in nature. Make a list or mind map of keywords and synonyms. Plan for single or plural words, specific and general words, nouns, adjectives, and verbs. Ask a friend to help you brainstorm and you'll quickly expand your results. Write down anything that comes to mind for now, doing away with less relevant terms later on. When performing a search, plan to use between 2 to 4 keywords. This combination of terms is called a search string. Try out your search strings in different databases. Aim to use at least 3 databases for your research. Remember that each keyword is important because your search will only return results containing that word. And finally, throughout all of this, remember to take care of yourself by taking mental breaks and feeding your loyal cat.
So let's talk a little bit about where you're going to put these. You're going to put these in research databases, these search terms. And research databases are organized collections of computerized information or data such as periodical articles, books, graphics, and multimedia that can be searched to retrieve information. Databases can be general or subject-oriented with bibliographic citations, abstracts, or full text. We can use general databases such as Google Scholar to start the search to cast a wide net, or more discipline specific such as Pedro to cast a smaller net, which is specifically for physical therapy. When thinking about choosing PubMed or CINAHL, PubMed is from the National Library of Medicine. It has a wide coverage of journal articles. It indexes back to 1947. It covers the areas of medicine, nursing, dentistry, veterinary medicine, healthcare systems, preclinical scientists, and related areas. It has clinical queries. It delineates results to clinical guidelines and systematic reviews. CINAHL includes allied health, including nursing, OT, PT, and other fields. And for each of these, you use Boolean search methods, which we'll talk a little bit more about next. Boolean searching is used in CINAHL and PubMed. Boolean searching uses terms like and, or, and not to help you limit searches. I'm going to play a video now to talk a little bit more about Boolean searching.
Welcome to this video tutorial on using Boolean searches in your library searches. This is a presentation by Kate Cushion, a liaison librarian at the University of Regina. You're probably asking yourself, why should I learn Boolean searching when I can search just fine in Google without it? Well, the answer to that is that Google uses something called natural language searching. Library-based databases and catalogs work a little bit differently. Natural language doesn't work very well in them. So it's important to use Boolean because this allows you to tell the database exactly what you want it to do in the database's language. This helps improve the precision of your searches. It allows you to form complex multi-part search strategies, and it will just allow you to have more sophisticated searching techniques. Most importantly, though, it helps you find exactly what you are looking for and find it faster. So let's take a look at some of the common Boolean operators. Now, if you don't know what that means, Boolean operators are words that you use to connect your search terms. The most common Boolean operators are or, and not. So let's take a look at OR and how that functions in your searches. Connecting terms using OR retrieves items that contain either or both terms. OR expands and broadens your search so that you get more results. It's excellent for synonymous terms, that is, terms that have same or similar meaning, but they are different words. So for example, education or teaching. This will retrieve all of the results that contain education, that contain teaching, and that contain both. It's also excellent for when you don't absolutely need both ideas, when one or the other is adequate for your research. So for example, novel or fiction. This is a nice broad search to get you started if your research is in this vein. And functions in almost the opposite way. Connecting terms using and retrieves items that contain both terms. Using and between your terms narrows your search and you get fewer results. And is excellent for connecting unrelated terms that are both important to your research. For example, gender and fiction will retrieve results that contain only both terms. Not is the final operator we're going to be looking at today. Connecting terms with not retrieves items that contain the first term and excludes items that also contain the second term. This is excellent for reducing irrelevant results. So for example, if you're researching religion but you're not interested in items on Christianity, this is a good search to use because that way you're retrieving everything that includes religion, but you are excluding everything that also contains Christianity. Now you do need to be careful with this because some of the results that include Christianity will be important to you, but this is a good start. Phrase searching is another important tool for searching. This searches for all of the terms in the order you enter them. It's excellent for titles, famous quotations, and any terms that you need connected in the order that you enter them. You use parentheses or quotation marks to indicate a phrase search. So for example, if you're searching for Catcher in the Rye, entered just like that, it's going to retrieve something that looks like this. This is not a very precise search. You're going to get a lot of irrelevant search results based on this kind of entry into the database. Instead, if you search for something like this, Catcher in the Rye with parentheses or quotation marks, it's going to retrieve the exact title that you're looking for. So whether to use parentheses or quotation marks is something that you need to look in the database's help or tips page for. There's usually a link to the help or tips page near the search bar. Truncation and wildcard are two more important tools. So let's look at truncation. The truncation symbol in most databases is usually a star or a question mark, but it can be other symbols. Again, consult the tips or help page to determine which one the database expects. Sometimes the symbol replaces one letter, sometimes it replaces multiple or even infinite letters. So again, you'll want to look at the tips or help page to determine what the database is going to do. This is excellent for searching for related words that start with the same letters. So for example, entering in spirit with a question mark or star will retrieve spirit, spirits, spiritual, etc., etc. Wildcard is a slightly different tool. This replaces letters within a word. So for example, if you enter in the term that I have as an example here, it retrieves woman or women. As with truncation, different databases use different symbols if wildcards are supported at all in that database. So be sure you're looking in the tips or help page to determine whether or not wildcard is supported. So where to use these tips? Well, you can use them in the University of Regina catalog. If you click on the advanced search, you'll see that our advanced search allows you to formulate searches that are connected with Boolean operators. Academic Search Complete, one of our popular databases, also uses Boolean operators between its search terms, as does the Literature Resource Center. Now, if you have any questions about anything you've seen in this video, or if you're having trouble using the catalog or databases,
So I'm going to stop us right there because Boolean searching is used in CINAHL and PubMed, and I'm going to show you a few videos that introduce you to searching both in CINAHL and PubMed.
Welcome to this.
Searching PubMed you can use with mesh searching, and I've linked you here a PubMed tutorial, but let's talk about building a search in PubMed.
You've developed a research question, conducted a preliminary search on your topic, identified some relevant search terms, and now you're ready to begin searching. Depending on your goals and your project, there are many different approaches that you can take to do just this. In this lecture, we'll look at a systematic approach that you can use in PubMed and other biomedical databases to find relevant articles on your topic. You'll learn how to use a combination of medical subject headings, mesh, and keywords in your search. Incorporate search techniques such as Boolean operators, truncation, and field tags, and run your search in PubMed one concept at a time. This approach is best suited for developing a comprehensive search such as the one you might use for a literature review. Let's get started. In a previous lecture, we conducted a preliminary search for the following research question. How are mobile apps currently being used to help individuals with high blood pressure eat a low-sodium diet? In this lecture, we're going to broaden the search to how are mobile apps currently being used to help individuals with high blood pressure eat a healthier diet? We can use this question to develop the type of search strategy that we would use if we were conducting a comprehensive literature search. From our question, mobile apps, diet, and blood pressure are our key concepts. To build the search, I'm going to work in a Word document, and I'll paste the final strategy into PubMed when it's complete. As informationists, we frequently use this technique because it allows us to think through all the terms and strategies that we want to use before we even get into a database. It also provides documentation of the search terms and strategy, which becomes vital if we want to rerun the search or let others know how we found our results. As a first step, we'll identify the relevant mesh for our search. As you might already know, mesh is a specialized subject headings or controlled vocabulary used in Medline. All Medline articles are indexed using this vocabulary. To better understand the value of mesh and why we include mesh in our searches, let's take a look at a common problem that occurs when searching. That is, that authors may refer to one concept using many different terms. For example, think about hand washing. If we want to find all of the articles available in PubMed on hand washing, just using the term could cause us to miss out on some key articles. This is because authors may refer to it as hand sanitation or surgical scrubbing. Sometimes they even write out hand washing using two words. If you just search for the term hand washing, your search won't retrieve citations where authors use these variations. To remedy this problem, databases such as Medline, Embase, APA PsycInfo, and CINAHL use a controlled vocabulary. In Medline, the controlled vocabulary is called mesh. Indexers who work for Medline read each article and tag it with the appropriate mesh. They use the most specific headings that are available and apply somewhere between 5 to 15 mesh to each article. For articles that address hand washing, they are tagged with the mesh hand disinfection. What this means for you is when you search using the appropriate mesh, such as hand disinfection, you'll retrieve articles regardless of the terminology used by the authors. There are several ways to identify relevant mesh for your research question. First, if you found an on-topic article in PubMed and it's indexed in Medline, such as this one titled Mobile Apps for the Dietary Approaches to Stop Hypertension, click on the citation's title. Next, scroll to the right-hand side menu bar and click on Mesh. This will take you to a listing of the article's mesh. If you see a heading that looks appropriate, click on the term and then the Search in Mesh link. You're now in the Mesh database where you can look more closely at the heading. Below the term is a definition and the year it was introduced. Read through the definition, and if everything looks good, click on the Add to Search Builder button on the right-hand side of the screen. Notice that PubMed puts the term in double quotes and adds the language (mesh). This is the syntax that PubMed needs so that it knows to search the term as a mesh. Copy and paste exactly what you see in this box into your Word document. Alternatively, you can identify mesh by going directly to the mesh database from the PubMed homepage. Scroll down to the Explore heading and click on the Mesh Database link. While it may look like you're still in PubMed, you're actually in a different database. You can tell this because you'll see the word mesh next to the search box. Now let's look up the corresponding mesh for our concept diet. I'll type diet in the search box and click on the search button. The results show several pages of mesh to choose from. It's worth scrolling through this list as you might find more appropriate mesh to use than the first few results. For example, if we were focusing on low sodium diets, we could use diet, sodium restricted. Instead, let's click on the heading Diet Therapy. This heading is defined as adjusting the quantity and quality of food intake to improve health status for an individual, which makes it a good choice for our topic. Again, I'll click on the Add to Search Builder. If you want to see the articles tagged with this mesh, click on the Search PubMed button and go into PubMed to see your results. From here, you can also copy the heading with the added syntax and paste it into your Word document. Let's move on to our last concept, blood pressure. There is the broad heading blood pressure that we could use, but I don't want our search to veer too far off the original question. So instead, I'm going to select hypertension. Let's click on this heading and scroll down to the hierarchy. Here, you'll see all the narrower mesh that fall below hypertension. These headings are automatically included when you search the broader term hypertension. The technical term for this is exploding. But if you want to exclude these narrower terms, you can click on the button next to Do Not Include Mesh Terms found below this term in the mesh hierarchy. Now when I add the term to the search builder, in brackets you'll see mesh : no exp. Essentially, we're telling PubMed not to explode this heading. But in our case, I'm going to uncheck this box and just search with the mesh hypertension. I'll copy and paste this into my Word document. Now we have 3 mesh for our research question. It's not uncommon to identify and use several relevant mesh for each concept, so we could keep looking through the mesh database. But for the sake of time, let's move on to the next step. In an ideal world, searching by mesh should be good enough to retrieve relevant citations on a topic. Unfortunately, this is not always the case. Sometimes there isn't a mesh for the concept you're searching. This is particularly true for terms related to technology and rare diseases. For example, there is no mesh for sporadic porencephaly. Also, new mesh gets added every year. If you're using one of these newer headings, like augmented reality, which was added to the mesh database in 2019, you'll miss older articles that were indexed under another heading. Furthermore, it can take several months for Medline to index new articles. If you only search with mesh, you might miss the most recent literature on your topic. For these 3 reasons, if your goal is to be thorough, you'll want to search using a combination of mesh and keywords. Once you've identified keywords that you'll use in your search, you can begin applying search techniques such as Boolean operators, truncation, nesting, quotes, and field tags to these terms. For our example, in my Word document, I've already identified 2 to 5 keywords for each term. Depending on the topic and the scope of your project, You may keep going until you've identified every possible keyword for your topic, but what we have here is enough to get started. Looking at our first concept, mobile applications, I'll use an OR in between the synonyms. Remember, we want articles that address any of these terms, so OR is the correct Boolean operator to use. I'll type mobile applications, or mobile technologies, or mobile healthcare, or mHealth. Then I'll go through this list and look for terms that I can truncate. Mobile applications might seem like an obvious phrase to truncate in order to find the terms mobile application, mobile applications, mobile app, and mobile apps. But currently PubMed only allows truncation with stems that are 4 letters or longer. So while we can use an asterisk at the end of the N to get application or applications, we'll need to write out mobile app or mobile apps. I'll also take the IES off of technologies and use an asterisk to find technology and technologies. Next, I'll put double quotes around any multi-word phrases. So I'll put double quotes around mobile application, mobile app, mobile apps, mobile technology, and mobile healthcare. I won't use double quotes around mHealth because it's a single word. Notice in PubMed I can now use truncation and double quotes at the same time. This is a recent change. Just make sure that the asterisk is inside the quotes. Last, I'll add field tags to my terms. Remember, for a comprehensive literature review, the TW or TIAB field tags are most frequently used. Test your search both ways to see which provide the best results. I'll start with the TW field tag for this search. So I'll put bracket, TW, bracket at the end of each term, making sure that I type it after the double quotes for my phrases. Before moving on to the next concept, double check to make sure the syntax is correct and that Boolean operators are in all caps. Even the smallest mistake, like missing an end quote around this phrase mobile technology, can throw off the results when you go into PubMed. I'll go through my other 2 concepts and apply the same treatment to them, adding ORs in between the terms and then incorporating truncation, double quotes, and field tags. Finally, double checking for typos and errors. As a last step, I'll use an OR and include my mesh into the searches. So the final search will look like this. Once you have the search the way you want it, you can go into PubMed and start to run your search. The method we're going to use is frequently referred to as the building block approach. That is, we'll build the search 1 block or concept at a time and then connect these pieces together at the end to see our final list of results. Start with your first concept. In our case, I'll copy the search for mobile applications and paste it into the PubMed search box. One of the benefits of searching one concept at a time is that you can catch any mistakes in these smaller blocks before you put everything together. You can see that I misspelled health in mHealth. PubMed notified me of this underneath the results. I'll go back to my Word document and fix this mistake. Then I'll run the search again. Don't be nervous about the large number of results. Remember, each time we and in another concept, the results will get smaller. Now I'll paste the search strategy for diet. In addition to looking for spelling mistakes, it's also a good idea to look at the search details for each concept to make sure PubMed is searching exactly how you want it to. Click on the advanced link and scroll down to the history and search details. Then click on the arrow next to details. Everything looks good here, so I can go back to the PubMed search box and paste in my third concept, hypertension. If you're on the advanced search page, you can also paste in your search strategy in the query box and click on the search button. Again, check the results for spelling and the search details to make sure each concept was searched correctly. Once you search your 3 concepts, it's time to combine them and see your final results. In the History and Search Details box, you'll see all of the searches that we've conducted so far. I'm going to delete this first search with our spelling mistake so it doesn't cause confusion. Click on the 3 dots under the Action heading and then click on the Delete link. Now I'm looking at the final searches for my 3 concepts. There are several ways to combine these searches. What I do most often is use the set numbers. You can see our first concept, mobile applications, is number 2. Our second concept, diet, is number 3. And our third concept, hypertension, is number 4. In the query box, I can simply type number 2 and number 3 and number 4. Remember, I'm using an and between the sets because I want articles that address all 3 concepts. Once the query box is how you want it, click the search button. As you look through the results, you should see your terms appear in the titles and abstracts. This is the first indication that your search is working correctly. Again, if you're in doubt, you can go back to the search details and take a look at how PubMed searched. If you don't like using the set numbers, you can click on the 3 dots next to each set and click on the Add Query link for your first concept. Then for each set afterwards, you'll click on the Add with And link. If you make any changes in PubMed, make sure to make all of these changes in your Word document. It's important to keep your Word document current so that you can report your search strategy and replicate it when needed. I often put my search strategy in a chart using the same number sets that I used in PubMed. This provides a clean and organized way to share exactly how the search was conducted. An important idea to remember when searching biomedical databases is that searching is an iterative process. Oftentimes, you need to make major and minor adjustments along the way. For example, after you review your results, you may see more terms that you want to add or remove from your search. Or you may decide to change your field tags or use of truncation after you see what these are doing to the search. While this may feel like extra work, remember that each change you make is bringing your search one step closer to generating relevant results. In closing, with a little bit of legwork and patience, you will be well on your way to developing an effective search strategy, following a systematic approach that uses a combination of mesh and keywords integrated with Boolean operators, truncation, quotes, and field tags is a key factor in building comprehensive searches that can be used for literature reviews and other research projects.
I know that was a long video, but I hope that will help you as you start thinking about searching PubMed. We also have a way to search CINAHL with basic and advanced search. CINAHL is searched very similarly to PubMed. I've linked some videos here, and if you choose to watch them, you can. The PowerPoint is available for you on Canvas. Let's talk a little bit about Google Scholar. Google Scholar has a wide coverage of all disciplines, but you can search using plain language. The advantage of searching using Google Scholar is that you might end up with a wide variety of results. Google Scholar will allow you to search using some advanced strategies. So if you go here and you click on advanced search, you can use some Boolean without putting it in directly into Google Scholar. So you can select all the words, for example, physical therapy, with the exact phrase clinical reasoning. And you can also limit your search per years. So if you look right here, you can see that you are pulling up articles that have clinical reasoning and physical therapy. You can also restrict your date range for the last 5 years if you choose to do so. And you can look at the articles that are pulled up. The advantage of using Google Scholar is it may help you identify articles because it uses plain language searching, and you may be able to get a broad variety of articles identified. You also have the Cochrane Library. The Cochrane Library is a library of systematic reviews, and it tries to give you clinically based information. The Cochrane reviews are systematic reviews, and it's a collection of databases that contain different high-quality independent evidence to inform healthcare intervention decision making. It hosts a register of controlled trials and also provides answers to guide clinical decision making. There's a video also linked here on how to search, but it does use Boolean searching, just like PubMed. There's also the physical therapy data research database, evidence database, or PEDRO. PEDRO is specific to physical therapy, and it includes data specific, and also here are linked videos on how to search using PEDRO. PEDRO also uses Boolean searching.
Welcome to this.
I'm going to just play this video because how it talks about it's short and it talks about performing a simple search.
A simple search in PEDRO, the Physiotherapy Evidence Database. You access the simple search page from the PEDRO homepage at www.pedro.org.au. Click on the Simple Search link in the left navigation bar or in the Search the PEDRO database section. With a simple search, you ask your clinical question using the single search box. This box allows you to type text into it. All the terms you type need to be in English. Generally, it is most efficient to type 2 or 3 words into the search box. Before starting your search, it is best to think about the question you are asking, as this will help you choose the best search terms. We will use this clinical question to demonstrate how to do a simple PEDRO search. In people with Parkinson's disease, does training using visual or auditory cues reduce the risk of having a fall compared to usual care? Let's start the search using one component from our clinical question. We can define the patient using the word Parkinson asterisk. We have deliberately omitted the apostrophe S at the end of Parkinson's. We also deliberately added the asterisk at the end of the word. An asterisk is the special character used in PEDRO to indicate truncation. By truncating, PEDRO will return all records containing words starting with the text string Parkinson. These would include Parkinson, Parkinson's, and Parkinsonism. To start the search, either click the search button or click enter. The search results page is then displayed. There are 261 records which fulfill our search criteria. This is a large number of records, too many to read to answer our clinical question. Let's click the Continue Searching Simple link to return to the search page and make the search more precise by adding some more search terms. Let's use another component from our clinical question. We can define the intervention using the word Q asterisk. We have deliberately used the text string CUE asterisk instead of a word like queuing. So PEDRO will return all records containing words starting with the text string CUE. These would include queue, queues, and queuing. All the words you type into the search box will automatically be combined with the AND Boolean operator. So your search for Parkinson and Q will return just those reports which have the words Parkinson and Q in their title or abstract, or in any of the indexing codes in PEDRO. Now start the search again. The yield is now 36 records. This is still too many records, so let's revise the search some more. Click the Continue Searching Simple link to return to the search page and make the search more precise by adding some more search terms. Let's use another component from our clinical question. We can define the outcome using the word fall asterisk. Our search for Parkinson asterisk and Q** and fall* will return just those records which have words starting with Parkinson and Q and fall in their title or abstract, or in any of the indexing terms in Pedro. Now start the search again. The yield is now 8 records. This is a good number of records to consider. You can read the title of each record in this search results page. Click on the title hyperlink to view the abstract and other details. We have just demonstrated how to do a Pedro simple search. In the search, we used an asterisk to indicate truncation, which is a sophisticated search feature for text fields. More information about searching is available on the Pedro Search Help page. Our search produced a large number of search results. To overcome this, we made our search more precise by adding extra search terms. The opposite can also occur. If your search returns too few or even no records, you can make your search broader by removing search terms. Searching via the simple search page may be a good introduction to using Pedro to answer your clinical questions because it is easy to use. Once you feel comfortable using the Pedro Simple Search, please try using the Pedro Advanced Search page. The Pedro Advanced Search provides more alternatives for asking clinical questions and may provide better answers for complex clinical questions. We hope you have found this tutorial on how to perform a Pedro Simple Search useful.
If you have any questions about literature searching or any of the concepts covered in this lecture, please post to the Ask Me Anything forum on Canvas.